Hi, I'm Anne Imanuel. I'm the co-host of Transform Table Talk Live alongside Dr. Maggie Yu. Today we have an interview for you with an alumni of the Transform program named Crystal. Crystal is a person who needs a lot of energy. Here's why. She is a mother of four. She's a wife. She's obviously maintaining her home. She's homeschooling her children, and she is doing long nursing shifts. We're talking 12-hour nursing shifts and going to school to be a nurse practitioner. Oh, and by the way, she's also a bodybuilder. So she needs a lot of energy. The problem is she was diagnosed last year with lupus and her whole world came to a halt. She was dealing with extreme crushing fatigue. She couldn't function. She was also dealing with widespread joint pain and also pain elsewhere, like facial pain really bad, ear pain really bad, interfering with her life, terrible headaches. Additionally, she was dealing with neuropathy to the point that it was interfering with her ability to walk. Well, you can't really function in life and do a 12-hour nursing shift and take care of four children if you cannot walk. So she was getting help from specialists, going specialist to specialist, who were not really helping much at all. They were giving her medications to try to treat the problems in isolation without looking at her as a whole and getting to the root cause. And actually, she was just progressing and getting worse under that care. She found Dr. Maggie, and as soon as she graduated from her nursing program, she signed up, she made that commitment, and she knew if she didn't do this, she wouldn't be able to be a nurse anymore. In fact, her rheumatologist told her, you probably want to go ahead and quit. That's not what happened. I'm going to give you a spoiler alert on this one. All of Crystal's symptoms are now gone. How did this happen? Let's find out.
My heart rate went from low 50s to 135 within seconds. My blood pressure went down to 85/60. I had a little monitor on me. It was dangerously low. I remember just sitting in that chair at the gym going, I can't go home. I can't call my husband. Like, I can do nothing. And it was at night because it's a 24-hour gym and my kids were asleep and I couldn't do anything. And that was the beginning of my POTS symptoms. As a nurse too, I was like, I'm either stroking out, even though my blood pressure, I'm like, I'm having a heart attack. I'm having a stroke. There is something very, very wrong. We're going to send you here. We're going to send you to, no, nobody could do anything. My little kids would pray every single day. And my little boy, mommy, God, please cure mommy of lupus and cure all the other mommies of lupus. And just at the time he's 3 years old, you realize just what an impact my sickness has on him. Hi, my name is Crystal. I have four children. I have a 4-year-old boy and a 5, 9, and 12-year-old girls. I'm married. I live in Tucson, Arizona. I'm a registered nurse and I'm going to school to become a nurse practitioner.
So you're very busy with 4 kids, a husband, a house, a job, and you're going to school. Not to mention you have hobbies outside of that. Tell me what some of your hobbies are.
I'm a bodybuilder. I'm a bikini competitor. So fitness is very important to me. I'm competing in the NPC and I'm one competition away from being an IFBB pro.
And for those of us who don't know what that lingo means, it sounds like the top of the top, right? Of the bodybuilding competition. Okay. So very active, very healthy until you weren't. All of a sudden it kind of felt like everything came to a head for you. Tell me a little bit about that.
So July 15th, I did a bodybuilding competition in Colorado. I was feeling fantastic. I'm 38 years old, but I felt like I was in my 20s. Very active, hiking with my kids all the time. And then within a week or two of coming home back to Arizona, I started to get a whole bunch of debilitating symptoms. My face was just totally numb. That was, I think, the first thing. I thought I really had like some random paralysis going on, like Bell's palsy. I had swollen lymph nodes everywhere, aches and pains, just really weird, dizzy spells. Long story short, within a month, I was diagnosed with systemic lupus.
Okay. So, and actually that's quite fast to be able to get that diagnosis because some people will have lupus for a long time and really struggle to get the diagnosis. How do you think you were able to go about getting it so fast? Was it through blood work and also symptoms and you went to a rheumatologist, you got in pretty quickly?
I got it. Well, in the medical profession, I know a lot of doctors. So I got into a rheumatologist literally the day after getting blood work done. So I first went to my primary care physician. They tested my autoimmune antibodies. And so I had the highest titers of the markers for systemic lupus that you can have. My ANA and dsDNA were very high. And so I called a doctor friend of mine and the next day he got me into a rheumatologist. And at first, go ahead.
Well, I was also going to say, I want to hear more about the symptoms that you were feeling as well, because you mentioned some of them with the facial paralysis, but there was so much more that all of a sudden was hitting you.
Yeah. So it started with a facial paralysis, the dizziness that ended up later being suspected POTS because it was POTS symptoms. I remember the biggest issue, I stood on a treadmill once and my blood pressure is normally low 50s, high 40s because I'm an athlete. And when I stood on that treadmill, it went up to 135. I had my little watch immediately and I felt faint and like I was going to pass out. I kept watching.
Your heart rate or your blood pressure?
I'm sorry, my heart rate went from low 50s to 135 within seconds. My blood pressure went down to 85/60. I had a little monitor on me. It was dangerously low. I remember just sitting in that chair at the gym going, I can't go home. I can't call my husband. Like I can do nothing. And it was at night because it's a 24-hour gym and my kids were asleep and I couldn't do anything. And that was the beginning of my POTS symptoms.
Okay. And what are you feeling at that time? Because I imagine being a lifelong athlete here and being so used to being able to rely on your body and all of a sudden, my gosh, it turned against you and you didn't know what's happening. That's gotta be scary.
Lots of tears at the moment as a nurse too. I was like, I'm either stroking out, even though my blood pressure, I'm like, I'm having a heart attack. I'm having a stroke. There is something very, very wrong. I remember at one point I actually drove myself to the emergency department and then had to pull over because of paralysis. I couldn't move my arms and my legs. And I had to have an ambulance come and get me and take me to the hospital. And they could find at that point, nothing wrong with me. So this was before the diagnosis.
Right. You're fine. Everything's fine. Your blood work looks good. I'm hearing that you have all these symptoms, but we don't know what's going on. And that's a very frustrating place to be at. You also were dealing all of a sudden with a lot of fatigue, right?
Unbearable fatigue. Yeah. And I'm someone that typically is an Energizer bunny. I wake up at 4, I work out for several hours. I deal with my kids. I work. I'm energetic and I really, there are no words to describe the amount of fatigue I had, but it was debilitating. I could not function throughout the day. I couldn't get off the couch to do dishes. I would like hold on to the wall and have to catch my breath. Napping would do no good. Nothing. Caffeine, I was living off of copious amounts of caffeine, pot after pot after pot of coffee.
But it really doesn't touch it.
Nothing.
People that haven't experienced this type of fatigue, it's hard to even explain what it feels like because it's not something where caffeine can just make you feel better. It can maybe tide you over to be able to function, maybe, but you feel so exhausted. Like, what did it feel like for you? I know when I experienced something similar, it literally felt like I had lead weight on me and I couldn't even move through life.
Yeah, that's actually a really good way of describing it. It's the fatigue. It's just this like, you're completely drained. There is nothing there. And it's not even like the brain almost kind of flatlines too. And you're in this haze and your body is just sluggish. You cannot, moving is difficult. Thinking is difficult. And again, napping and caffeine, they don't touch it.
Yeah. So you had brain fog also.
I did.
To go along with this.
Yes.
And of course, as a nurse and as a mom, you have to be clear-headed. You can't be fuzzy.
Mm-hmm. Yeah. And I'm homeschooling my kids and trying to deal with everything. And that was one thing that for nursing was quite scary because you have to be. I remember going, and again, my rheumatologist told me you probably are not going to be able to work as a nurse, not just because of the brain fog, but because you can't get through a 12-hour day. And she said, even with pills, I don't think that's going to happen for you.
That's what we're dealing with because you were going to school to be a nurse practitioner while also being a nurse, while also homeschooling your kids. I didn't even realize that was thrown in there too. So you had all of these demands on you and you were having to perform 12-hour nursing shifts as part of this. And so your rheumatologist says, it's not going to happen. You can't do this.
Yep, for sure. And that your life is going to be different now. And she talked to me about trying to get on disability and different options that were there because in her experience, this is something that we just had to consider. We had to consider that this might not happen.
Because it was only going to, in her experience and in her world, it was only going to probably progress. It was never going to get any better. It was probably only ever going to stay the same or get worse. Mm-hmm. And that's a dreary place to go. That is a really sad, scary, depressing, probably reality to start envisioning for you.
For sure. It was heartbreaking. And to add on everything else that was happening in my world, I had to now think about finances and think about, I put all this time into my career. What am I going to do? So it just added onto it, compounded onto it.
And you did approach your program and say, we have to work something out because I'm not able to continue performing these 12-hour shifts, or what did you have to do?
Yeah, so I had to go to Access and Disability at my school, and it was quite difficult, but they made it so that I did not have to do the 12-hour shifts, and I had to do more shorter shifts. And it was something that they said with lupus, I had a good advocate at the school because he said, it's like, there's the spoon theory. You really don't have energy. Yeah. And he goes, I know, he knew more about it at the time than I did. And I'm going, what? This is like a thing that people with lupus like, and he's like, yes, absolutely. And you really can't make it through the day. And so that was good that I got the assistance, but also another just like, how is this happening to me? I went from being so active and so strong, and now I truly have a disability. It almost wasn't real.
Well, and we'll talk about some of the things that you think may have contributed to this diagnosis, and also some of the things that have helped you turn it all around in just a little bit. So let's talk about, I know that there was even more symptoms because you had been dealing with insomnia as well, correct?
Oh, yeah. Yeah.
And that had been going on for quite a while.
Yeah. So since becoming a mother. So I think that was really the start of it. Before that, I could sleep like a log. And then I became a mother 12 years ago and would co-sleep with my babies and breastfeed. And that just, my whole rhythm, everything, and your hormones, everything gets completely thrown off. And I could never get it back on track. And so, I mean, we're talking like some nights, 2 to 3 hours, maybe. If I had a fantastic night, it could be 6 hours, but it would be interrupted constantly to use the restroom, constantly to, do I hear my baby, constantly to whatever I'm worried about, just that brain going. And so I couldn't sleep at all. And I know as a nurse, that's terrible for all diseases.
Yes, that's true. And then I just want to touch on the fatigue. Yes, you weren't sleeping and you were having these only, 2 to 3 hour a night, but you were functioning like that for a long time. It was totally different once you got lupus and had that additional type of fatigue, correct?
They're not even comparable. So the fatigue from being a mother and just being tired, that goes away when you take a nap. That coffee helps that, and you're just kind of going. I'm like, I knew I was tired, I was drained, but you got that motor and you're going, and it was fine. Yeah. And I had that for 11 years prior to my lupus diagnosis. So that was not the fatigue. That was totally different. And even up until my competition in July, I still had energy to play with my kids on vacation and train and compete. I had energy. Even though I wasn't sleeping, I had energy. Lupus hit and did not matter if I slept for 8-9 hours. I was done.
You were done.
Yeah.
Talk to me about, did you have joint pain, very bad joint pain?
I did. And of course I chalked it up to, well, I train.
Yeah.
So I must have lifted too heavy and then I also said, well, maybe I'm just getting older, like all of a sudden in the last couple months. It was just really.
Isn't it funny the excuses that we make though too? Because we always kind of do those things and then we're like, until you really realize, no, something's very wrong.
Absolutely.
Because so many of us do that. And there's so many ways to brush things off and say, oh, I'm getting older. And doctors do it to us too. You're getting older. Yes. Hormones. It's just deal with it. It's normal. This is
totally.
And so we can gaslight ourselves just the same way as a doctor may gaslight us until you really can't ignore a symptom any longer.
Yeah. And it did get that way where walking felt like I was on almost like I just was broken. Like all of a sudden I break my foot, like my ankle and my toes would just be really like, I can't take a step. That just the joint pain is unbearable. And the same thing with my knees. And it would kind of like move around. It wasn't. And so then I'm like, okay, so this can't be related to the gym because it's moving all around. And some
I
days
just squat legs and I'm having a bunch of knee problems or something like that.
For sure. And so it was very confusing because I wasn't familiar with it. So.
Okay. All right. So we're dealing with, now we've got insomnia. Did you touch on how bad the neuropathy was?
The neuropathy was weird because again, that would come and go. My legs, it started in my face and it was often the left side of my face, which again, I'm like, I'm having a stroke. Went to my hands, went to my feet, and then it would go up my legs. And it actually kept me up at night because it turned like painful. Not only was it weird and numb, but it was painful. And so I was having more trouble also with that sleeping. And then there would be times that I would try to take a step, and because I couldn't feel my leg, I would almost trip. It was this like really weird. Yeah, very clumsy and very, very concerning. And when I went to a neurologist, she told me, she said, I think that you have small fiber neuropathy. And if anybody knows what that is, that's not a fantastic diagnosis.
No. And I mean, I will quote from Johns Hopkins, usually no cure, usually cannot be cured. And people with, let's say peripheral neuropathy symptoms, they don't realize, because some people think, oh, what is that? Just like pins and needles. No, it affects so many things. Like you mentioned, it can affect motor symptoms where you can have weakness, a muscle atrophy, paralysis even. It can have sensory symptoms, like I mentioned, with the numbness and the tingling and the pain. And then it can have these autonomic symptoms as well, where your blood pressure can have changes. You can have emotional disturbances, changes in your skin, the ability to not sweat or sweat too much. All of these things start happening and you're like, what is going on? So there's so much that encompasses peripheral neuropathy. And yeah, most of the time, that's just going to be the way it is forever. So not something that you want to hear. And so it sounds like you were going to a lot of specialists and getting a lot of different diagnoses, and they were trying to like tell you, here's how we might be able to address this or not, but nobody was really looking at you as a whole.
No, and you nailed it. I was at so many specialists, and none of them looked at what's causing it, the root cause. And they all had their ideas of, okay, we can't treat this, but we can help treat the symptoms until it progresses further. So I went to
get worse. We're just waiting.
Yeah. So I went to my rheumatologist. I went to the neurologist. I had to go with my POT symptoms. Of course, I had a cardiologist. So I was wearing a heart monitor for a month. I had to have EKGs. It was just it was scary. I was so scared. And then I haven't talked about yet, but this pain right here that was so random. Like, who gets pain but so stiff, so painful.
Joint pain in your jaw, or what was it?
So I went to an ear, nose, and throat doctor, and he said, oh, you probably have TMJ. Okay, but I'm like, I don't think it's quite my jaw. It's like my ears. It's like behind my ears. Also right before my diagnosis of lupus, I thought I had ear infections because there was so much pain in my ears, and my ears looked fine. And I had like weird neck pain, and I had just all these bizarre, and my sinuses were killing me. And so the ear, nose, and throat doctor, though, was like, I think you need to see the neurologist, and I think you have TMJ.
Okay.
So they didn't help me.
No help at all, really. And they're looking at you and you're fine on the exam, right? You don't have an ear infection, but you're experiencing this pain. So they're stumped. You're stumping specialists, and that's never a fun place to be.
Yeah.
Okay, so you had that. And you also were having some skin manifestations as well, some hives and things like that.
Yeah, definitely. And so then they said, suspect mast cell activation, because I would have a lot of hives. I would have a lot of itchiness. And I actually had itchiness when I first had my first daughter. I had a lot of itchiness on my legs that was completely just unexplained urticaria, or urticaria. They didn't know what it was. Again, and it went away, but then it came back with a vengeance, and it was like all over, just these huge hives and itching. And that's also unbearable when you're like, sitting here like a crazy person, scratching and bloodying up your skin.
Well, and you're wondering too, is this going to progress? I mean, that's how I would be. My mindset would go to, I'm having hives. Am I having some kind of allergic reaction? And is it going to progress to something more serious where we deal with anaphylaxis or something like that? And what's the cause? What's the trigger? Could you ever determine why it was happening?
No, because when I started Maggie's program, my symptoms went away.
Oh my gosh.
They just went away. So we didn't have to even get to a cause. Part of it, I think maybe was my food mapping results helped with like a lot of the itching. So I think that some of it was the health food that I thought I was eating.
Yeah, exactly. Because you were so healthy, we thought. One last symptom I just want to touch on before we get to how you did with Dr. Maggie and the Transform program was something that was really impacting your life in a big way, which was the photosensitivity, which is something that is so common with people who have lupus, but it was impacting your life to where you were having to change plans and really rework different angles of your life to accommodate for this. Tell me more about it.
So my doctor called it photosensitivity. Anytime I would walk out into the sun, I live in Arizona, does not matter if it was the sun had just peaked up or was just about to go down, I would get within minutes, I would get these rings on my face, and the swelling, red swelling, rings, pain, burning. And so I'm vain. I don't like that at all.
Like that. Not to mention, it sounds uncomfortable.
It hurt. And I was vain. And I would also get it on my chest, my shoulders. And then I would, So after the sun exposure, I would start to feel tired. I would start to have like all this joint pain. And I just was like, wow, I'm all of a sudden like kicked into a bigger flare because I've been outside. And so
it's triggering your immune system to have a response here. And
completely.
you were starting to realize that.
Yeah. And I had to, it was so bad that I had to wear gloves, a face mask for skin cancer, and I would double them up, put 2 of them on, a hat. I actually have a picture.
And this is like the heat of the summer.
Yeah, this was actually, though, when I got diagnosed, this was September, October is when it started. And even through December, even through the winter months, I couldn't drive because if I had to drive, the sun comes through the car. It was awful. And so again, I'm covered head to toe. My chest has like a scarf wrapped around it, this big brimmed hat, glass, the whole deal. And if I did that, even that way, it would still get to me somehow. And so I couldn't be outside for long. And who really wants to go outside when you look like that?
Right. And you have little kids who probably want to go play outside, and you're not able now to do that.
Yes.
With them.
And I mean, honestly, like I would cry and cry every day because my little kids, we are such an outdoor family and we couldn't go outdoor anymore. And then also just imagine being in a house and no windows can be open. So I had to not only have the windows and the shades, I put this like black stuff on them. And we have these metal shutters, and I had to have all of those on so that we lived in a little cave. Yeah, we lived in a little cave.
The world was getting smaller. I mean, it really is a analogy here for you were closed, you were putting the walls up, and your world was getting smaller and smaller because you were able to do less and less, and you actually physically had to do that as well. You were having to box yourself in because you were sick otherwise.
Yeah, and I had to take my kids out of ballet and voice lessons because I couldn't drive them there. And then even if I got in, the room had this one little window. And because of that one little window coming in, it was like a vampire. It was like burn. It would always like burn my skin. And
you said it's embarrassing, but it's also, debilitating to your life. It is making your life you're not able to function in it. You're not able to support your children. And you had to pull out of these activities, which I imagine was really, really tough because as a mom, you just want the best for your kids and you want them to be happy and involved in everything. And you're feeling like, well, I'm the cause of why they're not able to do this anymore.
Yeah. We couldn't go to family gatherings because other people's houses have windows. So, and it's hard, like, especially if it's Arizona. So people have big, beautiful windows and we can't cover them all. So
what did they offer you? Did they put you on some kind of medication?
Yes. So I was on the kind of intro baseline hydroxychloroquine for lupus. And my doctor thought that my symptoms would get a lot better within 6 months of taking the drug. And they never once improved. They only progressively got worse and worse and worse. And the hydroxychloroquine hurt my stomach at the beginning.
So you had side effects from it. And if the medication was the answer and you felt better, great. Nothing wrong with medication if that is what's going to help you. And I'm sure you feel like that as a nurse too. You're in the medical field. There's a place for this, but it wasn't helping you and you were getting worse and you were having side effects from it. So I imagine you being a nurse and having this medical background started researching, what can I do? How can I address this? Is that what happened?
Absolutely. I immediately started researching, and I actually have a lot of experience with holistic healthcare and alternative medicine. And so I knew, I was like, the route I'm going isn't going to fix me. And so I started researching that. And Maggie, immediately, I saw the success stories. I watched her interviews and I said, when I have time, this is who I'm going to.
Because when I have time, what were you trying to get through? You're trying to finish school. You were trying to just make it through that. And so this was a period of just a couple of months, probably. It
was. Yep. So it was a 4 months. I just knew. And I said, in 4 months is when I'm going to dedicate my time. Because if it doesn't work and I don't get better and I progress, then I'm never going to get to come back to finish this because I won't be able to. So I just used whatever little energy I had left to get through. And then I dedicated everything to Maggie's program.
You were almost at a point of nothing to lose. However, did you have reservations about signing up for this program? Because it is a commitment. Yeah.
And also I'm a nurse. Our finances are tight. I have 4 kids.
In school.
In school. So this was definitely, it sounds like, wow, this is like a big chunk of change to do for something that doesn't work. But if it does work, I mean, it's just a month or 2 of my salary as a nurse, which if I don't get better, I can never do again. So that's where, to me, I was like, I just have to put faith in this. And she had enough success stories that I felt comfortable putting my faith in her.
I'm so happy that you were able to take that leap. And now we're interviewing you as a success story.
I know.
Let's get right down to it. Let's hear, where do you stand with your symptoms now? I'm going to go one by one because I know that your life has totally turned around. And even in some of the symptoms that you weren't expecting, how is your pain?
None.
You have no pain.
I don't have pain.
And this is something that was debilitating to you. No. Okay. How is the fatigue?
Normal fatigue now. I have normal mom fatigue. I don't have that like extreme fatigue. Totally gone.
Totally gone. Okay. What about the POTS-like symptoms?
They are, you're going to get sick of me saying this. Gone.
Let's just go ahead and say it then. All of your symptoms have disappeared, dissipated, and turned around.
Literally all of them. And it seems like, to me, literally when I say that, it's like, how can that possibly be? How can that be? I have no idea. I mean,
weeks, right?
Yeah. So the majority of my symptoms went away within a matter of weeks. Now, my antibodies were still high. My white blood count was still low. That took some time to turn around. And my sun sensitivity was still high within the first few months of the program. But within the first week, aside from what I just said, the first few weeks, all of my symptoms were gone. And it started with sleep. I remember just a couple days into the program with managing my blood sugar, staying hydrated. I slept like a baby for the first time in over a decade. And I was like, okay, coincidence. Yeah. And then it happened again. And then it happened again. Let me tell you, 7 months later, I still sleep like a baby. When I go to bed, I fall asleep within 10 minutes and I wake up when my alarm goes off.
And this is something that I was referring to when I said you weren't even really expecting to turn around because you were dealing with insomnia since long before you were diagnosed with lupus.
Mm-hmm. Yeah, I didn't even think that wasn't even a symptom to me. That was just mom life.
That was just mom life. But now you're getting a solid amount of sleep and you're waking up feeling refreshed.
Yeah. I get groggy when I wake up. My alarm goes off and just like my kids, I'm like, and then within 10 minutes, I'm like, okay, I'm up and I'm starting my day and I feel good.
And you have your energy back.
Yeah.
And that's really the big key for you because you are a woman. If anybody needs energy, boy, it sounds like you do.
Yeah.
A lot going on. And so you've got that back. I want to hear about, we mentioned the joint pain was gone. All of the ear pain, the facial pain, the numbness, the neuropathy, all of that has resolved?
Completely resolved. I've gotten a few viruses during the program. And when I do, I'll get a little bit of sinus pain. And Dr. Maggie's addressing that with lots of her tips and tricks. And when my colds go away, that goes away. So aside from that, which I think most people get that pain, yeah, it's gone.
You're gone. Okay. What about the mast cell activation symptoms? So you were experiencing these hives, very itchy. Do you have any of that anymore?
No. And I take digestive enzymes, which I think was a really big component. When you're in the program, Maggie talks about how most of us with autoimmunes have a hard time with digestion, and she knows just what to give you based on your blood work. And so I was taking digestive enzyme, which again, immediately I could tell with my bowel movements, there was change there. And then the food mapping results. I mean, I was eating almonds, cashews, pistachios, like on a rotation every day. And I was having dairy, like my whey protein for workouts every day. And those were things that I was highly reactive to. So it took about...
You would have never figured that out on your own.
No, because I don't have any anaphylactic shocks. And, I don't have any big symptoms when I eat nuts. I have no symptoms. But I was clearly having symptoms, and my itchiness completely went away when I resolved that.
Right, because there's a difference between these immediate emergent symptoms and these low, slow symptoms. And that is what can be so tricky because it's really hard to pinpoint how is this happening because it's not immediate. And there are different kinds of symptoms. It's not like he said, you're going to start sneezing or can't breathe or have, immediate hives all over your face and your mouth is swelling. It's not like that, but you are experiencing these other symptoms from them. And it's only through Dr. Maggie's proprietary food mapping process that includes so much more than just the food testing. It includes the focuses and the emphasis on digestion and proper digestion that really helped you get rid of all of that. I mean, mast cell is one of those things that is so hard for people and for doctors to deal with because It's a mystery. It is a mystery to most people, but Maggie can see the patterns and Maggie knows how to fix it. Dr. Maggie and her program that she's developed here. So as soon as you cut out those foods, did you start to notice a difference?
About 3 weeks.
Okay.
It took about 3 weeks. I thought, after maybe about one, I was like, am I feeling something? I'm not sure. But within 3 weeks, I was a different person. And I remember I would like scratch my back so much that there was like, it's kind of gross, but like little scabs because I would scratch it so much. And I remember telling my husband, I was like, look at my back. Just look at it. And I'm like, it's not in my head. It's not in my head. It's the itching, it's subsiding. So
this is just incredible. And so, usually I'm like, what made the difference? And you've mentioned some of it. It's the food mapping and taking out some of these trigger foods that were really inflaming your body from the inside out, starting a war from the inside out. And you mentioned a little bit to me about the way that you ate previously and how balancing your blood sugar really made a big difference. But I want to hear more about that. I imagine as a bodybuilder, you had a very strict kind of diet and things like that. Were you doing intermittent fasting?
I was intermittent fasting for years, for like a decade. And so the length would change, but at the end, I would get to sometimes 20 hours of intermittent fasting. And so my food that I ate was actually, I've always eaten healthy. It was pretty similar to what was on the program, but it was all crammed in this little tiny time. And when I would fast, I didn't realize that was causing a lot of my numbness and tingling too. A lot of my blood sugar issues. And so Maggie was like, when you wake up, you eat. What? When you go to bed, you eat, huh? Like it was just
so foreign to you to probably have to try to.
Yes, it was totally foreign to me because again, even before I would eat at the earliest, it would be like 4 p.m. when I would eat. So this was very different than, okay, you wake up, you have your water, you have your food. And then I immediately felt great too. I was like, wow, why didn't I think of this? So basic, just eat some food.
And I'm curious to hear, because you're somebody that, really has a good idea of how eating this certain way is going to help me create the figure that I want. How did that change your physical appearance? Were you still able to maintain a bodybuilder's body, then if you were able to work out again? But you know what I'm saying? Like, people are always so worried. Well, if I leave intermittent fasting, am I going to gain weight? Did that happen for you?
No. Again, I have gained weight, but that is because when I got diagnosed, I was extremely lean because of my competition that I had just done. So I already was probably 20 pounds below where I needed to be and where I usually live in the off season. So it's really hard to say with that. But I can tell you that if I eat properly the way Maggie wants, I will not gain weight. I will not. It's just, I had a lot of weight to gain to get to a healthy weight to begin with. And I had to just kind of like allow myself that space that right now I'm healing. So I'm going to hypernourish and I'm going to allow myself to get to the healthy weight, if that makes sense. So, but I do eventually, now that I'm feeling so good, once I have a little bit more time, I'm like, I'm going to start baby steps to try to get back my physique. Not of course where it was, not that super lean, because I don't think that's healthy, but definitely get back to my fitness body. And I know that I'm going to continue eating the way that I eat with Maggie. For sure.
So you're still able to enjoy the hobby that you love, to feel well. And that is something that probably was way out the window. You weren't even thinking could be something that you were going to be able to continue, because you didn't even have enough energy to like walk across the house, much less continue to be a bodybuilder.
Yeah. No, that was definitely gone. And now I'm like, I think I could do it again. But again, I go back and forth because I don't want to get sick. I don't want to, get too lean. But I definitely, now I can be a fitness person again. I can be fit. Yeah.
You can be fit and you can feel good. And this is something you can enjoy doing. And I know your husband is also very, I imagine, fit, because he runs, did you say jujitsu?
Yeah, he owns a jujitsu academy.
So
yeah, we're very active as a family. All my girls are in it as well.
And are you able to get the kids back in their activities now?
Yeah. We're back. We are back to doing everything. I am taking these kids to birthday parties, taking these kids to friends' houses. We are going to families' houses again. It's incredible. And my kids, they always go, every day, oh, thank you for the sun, because mom's back outside with them.
Okay, let's talk about that, because I know you had mentioned that photosensitivity was one of the things that you still had to work on. Dr. Maggie's Transform program, she says, launches you into a year of a health turnaround. So at the completion of the program, all of your symptoms, everything had gone away except you were still working on your photosensitivity. And so there are options to work with Dr. Maggie, and she will talk to you at the end of the program to see, is it necessary? Do you still have more to work on? There are avenues that you can pursue to be able to address more. And so that was determined that you needed to sign on and still work with her in a capacity, and you did. And then it was through that finally your last symptom, this photosensitivity, this thing that was boxing you in your house and keeping you from being able to take your children places, went away.
It went away. Yeah, it went away.
Huge impact on your life.
Huge. I mean, I can't even express how miserable, life in a little box was. And I can't even go there right now too without getting all teared up. So to be able to get back outside, and it was something that I didn't think, honestly, I was like, Maggie's a miracle worker. She has cured me of all these other symptoms, but I was like, nobody's going to fix my son's sensitivity. I'm like, I'm going to go because I had faith before. I'm going to have it again. But I was really okay with that because I felt good in so many other ways. But I remember I was on a call with her and she had done some additional testing and determined that I had these infections that were, we had been working on for the program and setting the groundwork for clearing these. And, I just broke into tears because it was like, there is another piece. There is another piece for me. And
there's an answer.
Exactly. There was an answer. And I mean, immediately Maggie was like, you're just gonna, go to the shop, take these, and gave me some other advice. And I followed it. And it was like the layers literally came off. I remember I was like, I'm going to try no gloves today. I'm going to try no scarf today. I'm going to try to wear sandals. And mind you, it's like 110 degrees where I live. So
you wanted to be lighter clothes.
Yeah. And so I was just able to start, taking things off. And right now you can see I'm in a dress. And yeah, there's kind of some things here because I still cover a little bit, but I don't need to.
Your chest looks great. You're not having, and I can actually see in the reflection in your glasses, there is a window or something facing you right now.
Yeah. And there is. I'm sitting here in my window and I'm absolutely fine. And it's incredible. I just took last month, I went on a whale watch. I took my kids to California, something I couldn't even get in my car to drive to California. I drove them by myself. So that also was something that there was no way I couldn't do anything by myself without my husband. So I took all 4 kids in the car, drove to California. We went on this whale watch. I was able to experience life. And I just remember feeling the wind on my face and my hair.
Are you on a boat on this whale watch?
Yeah.
On a boat, I imagine. Okay. Because I'm like, you're not just seeing it from like, we're taking a helicopter or something.
I was in the front of the boat and I was feeling the wind, feeling the sun, middle of the day, middle of the summer, and I'm with my kids. And it was just like, my life was given back to me. My life is back.
That's what I'm wondering is, can you even put into words what this has meant for you and for your family to have mom back, and not just mom, but the career woman, the wife and the mother and the teacher and the hobbyist and all of the things that you do. What is this like? Because all of that had kind of started to fade away in your identity. It sounds like, and now it's back.
Yeah. I felt like, some people, if they have a near-death experience and then they say that every day is a gift, that's how I feel now, where I really wake up and every day is a gift because I'm awake, I'm not in pain, I'm rested, and I can go about my day. And I really, a day does not go by that I don't open my door and go, thank you, God. Thank you, Maggie. And I go about my day because it's just, my life has been given back. So I actually have a lot more joy because I used to not like the desert so much. And now I'm like, this is beautiful. Look at the sky. Look at this world. And I used to not like driving my kids places, but now I'm like, look at me go. I get to drive my kid places. So it's completely given me a new perspective on life and gave me my life back. And talking about my family, my little kids would pray every single day. And my little boy, Mommy, God, please cure Mommy of lupus and cure all the other mommies of lupus. And just at the time he's 3 years old, that's in his prayer. I never told him to do that. That's in his prayer. You realize just what an impact my sickness has on him. And so he also the same thing, I get to go outside and he goes, isn't the sun great, Mommy? You get to come outside with me. And my dad told me that he would sit in his house with beautiful windows everywhere and skylights And this is a 75-year-old man who's also very active and strong, would bawl. He said he would sob uncontrollably and say, why? Because he knew how much my life was affected. Like, he had lost his daughter to an extent too. And my parents kept saying, there is nothing we can do. They've always been able to help me. And there was nothing that they could do. And my parents said, we'll send you to, my dad had cancer. Oh, we go to MD Anderson, we're going to send you here. We're going to send you to, no, nobody could do anything. Nobody could do.
People come to Dr. Maggie in the Transform program after they go to all of these special hospitals, after they go to Johns Hopkins, after they go to the Mayo Clinic, and after those places turn them away and say, there's nothing else we can do. Like, this is just how it's going to be. This is life. We can manage it, but it's never really going to get any better. And that's just not the case. There are ways to address this. You have to look at the root cause. You have to kind of really take a good hard look at what is going on in your life. And you mentioned to me as well that mindset was a big part of this. I want to hear more about that.
So I hadn't realized kind of how negative I had gotten in life sometimes. I mean, I was a very positive person on the outside, but I definitely had this, when things didn't go right, as Maggie calls them, automatic negative thoughts. Yeah. I would go, So working with Maggie, she weaves mindset into every module that you learn with her. And she has activities to change that. So the automatic negative thoughts, you change them from, okay, this situation, yes, I could think that, but what could I think that's positive? How could I look at it from a different perspective? And that really does affect your health. I mean, undoubtedly, the mind plays a huge a huge role in your healing and in just your health in general. And so it was incredible that I had that with her. And then also the support groups. So we had a little pod that we work with, and all those women are so kind and so sweet and so uplifting. And we get to really talk about things that maybe I want to talk about with my husband, or talk about obviously with my kids or my friends. So yeah, the mindset work was big with her program.
I love that. And you mentioned all these women. So oftentimes there's a lot of women in the program, but we've got men in the program too.
For sure.
Open to everybody, children. Doesn't matter the age, whether you are young or young at heart, and men, women. This program is for everybody. However, you happen to have all women in your
my group, but our group was we had five women. So in my group, I had 5 women in my group. But yeah, I have 3 daughters and a son, and I want to get my daughters into the group eventually.
So you think your daughters could benefit from this program?
Oh.
You're saying, tell me more about that.
Oh, yeah. So my 12-year-old has really bad constipation, and it's really messes up her stomach. And she just tells me, Mom, something is wrong. Something is off. My 9-year-old is much worse. Not only does she have the digestion, where incredible constipation. Now, I gave her digestive enzymes of Maggie's, and she now goes to the bathroom regularly, where before I was having to give her frequent enemas because even what the doctors were giving her was not working. And we eat tons of vegetables. So it wasn't about diet and hydration. It was just, no, we don't have, genetically, we don't have the proper enzymes in the stomach acid. And so, but yeah, she just got admitted to my rheumatologist because she has enough symptoms now. And she has some blood work that shows she's got some autoimmune stuff going on. We don't know what yet. And my expectation is we probably won't know. That's not something, but it doesn't matter. As Maggie says, it doesn't really matter what it is. You treat the autoimmune environment. And that's what she needs.
How amazing too, because for you, it didn't really come to a head until you were an adult, but you were already seeing this transpire in your children at a young age. And you, though, now are equipped with the tools to be able to help them. I mean, even if they didn't start the program, which you say eventually they will, and that will be such a big help for that. But you're equipped to be able to know what to do because you get this education. And as somebody with a medical background who was actually going to in a medical program just before this happened, I wonder if you might touch on the education aspect that you get from the Transform program.
Sure. So it's what I wanted to get when I started nursing school. I mean, honestly, to really learn how to heal bodies and how to prevent disease is something that Maggie hits on. She lays the groundwork and she teaches you. I I mean, I had a medical background to begin with, so I knew some of it, but she went even further than I learned in nursing school about digestion. She went further into nutrition. She just went further into blood sugar. I mean, as a nurse, I treat patients with diabetes. I know how to administer insulin. I know how to, nothing like that, but I didn't know anything else. And she teaches you how to balance that blood sugar. And so I've actually taken that and used it on my patients. I've taken her, I have psych patients because I'm a behavioral health nurse too. And I take her mindset work sometimes and take them to work and work with those patients using that, which is pretty cool. But my children are not in the program yet, but I know how to help them balance their blood sugar. I know how to keep them hydrated. I know how to complete their meals. So I definitely, even though we don't have the specific testing yet, I am able to take what I have learned and use it on my family and on friends, because a lot of people have these conditions. There might be a few that have one specific one, but when you look at them as a whole, it's a big subset of the population that has these conditions. And so I already feel like I have so much knowledge from what I've learned in Dr. Maggie's program that I can help my friends, I can help my family, I can help my patients.
Well, you bring up a good point, and it's that who is this program for? Is it just for people who are dealing with an acute problem or an illness like you, where your life came to a halt? Or could this benefit a very wide range of the population?
It really can benefit a wide range, and it can stop diseases before they happen, I feel like, too. When people are starting to have the symptoms, so like my kids, I feel like they're just at this prime age where they don't really have a solid diagnosis yet. And if we use what I've learned in the program on these people, then they're not going to develop into that. And I actually had Hashimoto's when I was 19. And my doctor, my endocrinologist, was like, it's okay. You just take a pill for the rest of your life. No big deal. Literally verbatim what they told me. Don't even worry about it. Like, your life is not over. You take a pill, and yes, you have to take it for the rest of your life. That's very important, but you're going to be fine. And I was okay. And because I got that diagnosis when I was 19, and I didn't get diagnosed with lupus till I was 37. But had Dr. Maggie come into my life with this knowledge, I certainly would not have intermittent fasted. I would have prioritized sleep, mindfulness. My diet would have been different. My hydration would have been different. And I probably also would have gotten my gut health tested prior, and food sensitivities, because I've been eating these foods for 30 years.
Yeah. And so, yeah, it's so interesting because there are so many people who are dealing with something like Hashimoto's, and their doctors tell them it's an easy fix. We're just going to give you these pills. Yep. Oftentimes they don't even properly test what is happening from you after that. You know, they just put you on a medication, and they're not really properly monitoring, as you probably learned in the program, the exact tests to be monitoring if you're on the right medication dosage or what have you. But for the most part, people can go about their lives oftentimes well after that, until they can't, because that is an autoimmune disease. And yes, it happens to be attacking your thyroid, but when is it going to turn and attack something else in your body, like what happened to you? And the autoimmune march does not stop. If you have one autoimmune disease, Crystal, you answer this, what's the likelihood that you're probably going to have another autoimmune disease or another attack on some other organ system?
Very high. And I don't even think, if I didn't find Maggie, I told my husband to justify the cost of the program. I was like, it's not going to stop with lupus. I'm going to get Sjogren's, which they were suspecting already. I'm going to get something else. It's just, this is the beginning, and it's just going to continue. And I've seen that with lots of friends. Yeah.
And Dr. Maggie talks about, would you rather kill Godzilla as an egg or when he's right? Yes. So let's stop it wherever you are in your journey, whether you're at the beginning just experiencing some symptoms, or you have really been dealing with a full-blown diagnosable disease for a long time. Wherever you are, that's the best time to start, because it's really going to get worse. So as early as you can address it, the better. And I love to hear your perspective of, even when symptoms are just starting to show up, or when you are just wanting to make sure that you're optimizing your health, it's a good time to go ahead and think about doing something like this, because this is what you wish you were learning and you wish doctors were teaching in medical school, but you're just not. It's just not the path that our medical system is set up for. So, wonderfully, you are now able to touch so many people, not just you, your direct family, your friends, but your patients are so fortunate now to be able to have somebody with your background, because you have now learned everything from Dr. Maggie, and you can help apply that to your profession. I think you're going to be a very successful practitioner for many reasons, but additionally because of this. And so I just wonder if you think that, this is going to be a big boon to you professionally, probably as well.
Absolutely.
What would you say was your favorite thing about the program?
I mean, feeling better. I don't know a favorite thing about the program. Of course, the results. I mean, that's what I should say. The results are my favorite part of the program. But it was also nice when I felt like my world was crumbling to have such an incredible support system. And being on the weekly calls, and you guys are amazing, and hearing the success stories. We always start with wins, and I love that. And it goes through and you get to hear about everybody's transformation and everybody's win, and it's so uplifting. So that was pretty cool too.
Well, is there anything that we didn't touch on that you wanted to make sure that you included and added in this?
I don't think so. I think we really went in depth on, I guess I just want to say, if you're wondering if this program is right for you, it is. It is. And I really wholeheartedly believe that. And I would recommend it to my patients. I would recommend it to my family and friends. This program is helpful for your mental health, for your physical health, and again, for all of those around you, that you can take the information that you've learned and apply. So if you're on the fence, don't be.
Crystal, thank you for your time today. I know you're going to touch somebody else and help them just as you watched these interviews and they helped you. So kind of coming full circle. Thank you for that. And just congratulations for your incredible success and feeling so much better. And these results, I should say that you're not the outlier. These results are typical, but congratulations for putting in the work.
Thank you.
Feeling so much better.
Thank you so much. I really appreciate it.
Before I let you go, they probably wrap up the primary part of the interview there, but I do want to ask you, because you mentioned that some of Dr. Maggie's supplements were really pivotal in helping you. And so they might want to use that for the store, her online store.
Sure.
So what was there, what were you taking, you think, from her store? And I know some of it's probably going to be from the infection standpoint, but was there anything else that was just really helpful?
My kids, so I take Digestit. My whole family takes Digestit, and we absolutely cannot live without it. My children were not being able to go to the bathroom, so much so that I had to give them enemas frequently. And now, within just a week of taking Digestit, they were going to the bathroom regularly, once, twice a day. It's soft. It's not painful. And then I know that it's the Digestit causing this, because when they go to a friend's house or they go somewhere we forgot it for a day or two, they go back to being constipated so much that it hurts and they can't go. So then I give them Digestit and they're good to go.
And they're good to go. And that's so amazing because, these are all of your kids. I mean, some of these children are young kids, but parents might be wondering, is this okay? Adults can take this, but are they on the chewable one?
Yeah. Yeah. So my little ones are on the chewable, and then my big ones take either chewable or the regular pill, whichever I have around. And I take it also every day with my meals, with snacks. And I notice a difference too, because at work I forgot them before, and you can just tell. I can feel in my stomach the discomfort coming back when I don't take them.
And then that can snowball for you into other symptoms that aren't just digestive symptoms, right? Like if you let your digestion get out of whack, some of your lupus-like symptoms can also start to reemerge.
Yeah, absolutely.
And so it's stopping it in its tracks. So not only are you not having digestive distress, but then you're not getting joint pain or any of the other things, the exhaustion that may contribute to just feeling terrible.
Yeah, for sure.
Did you ever have any diagnosable cysts, goiters, nodules?
No.
Okay. But you've had Hashimoto's for almost 20 years now, I guess, almost.
Yeah.
And this was something that you were never addressing before.
So I take the Thyroid Protect Cream, I take selenium, and I take vitamin A10, all to protect my thyroid. In 20 years of having Hashimoto's, I was never told that I'm at an increased risk of thyroid cancer, which is kind of upsetting. And when Maggie said that and suggested taking these supplements for thyroid health, I immediately jumped on it, and I'm happy that I did.
Yeah, because you had been dealing with this for 2 decades and you never once knew going to a specialist that you were at a 10 times greater increased risk for thyroid cancer. Now you know that you can take proper steps to go ahead and thwart that danger. And I imagine that at least gives you peace of mind.
For sure. Yeah, absolutely. So I feel a lot better now.
In addition to, I'm sure she gave you recommendations too about monitoring it and getting potentially regular ultrasounds.
Yes, she did. Yeah. Which again, no one has ever told me that was necessary. So a lot of knowledge, a lot of invaluable knowledge there in addition to the supplements.
And instead of waiting for you to get cancer, which is apparently what the conventional medical world is just waiting on for you, you're able to have these interventions with the Thyroid Protect, the selenium, and the vitamin A. Talk to me a little bit more about how do you use the Thyroid Protect for somebody who doesn't know?
Sure. So you just put about a pea-sized cream in your hand and you just rub it over your thyroid. You do it in the morning and night. It's very easy and quick, and it protects it.
Yeah, because it's actually got glutathione in it that is, you're applying topically directly where it needs to be instead of just ingesting glutathione and goes throughout your whole body. This is a targeted approach to really offering your thyroid some protection from developing goiters, nodules, and cysts, and actually treating them and helping to decrease them if that is something that you already had. So that's great that you're already on that. Okay. I took a lot of your time. Thank you for being so generous with it. You did a wonderful job in this interview, so I really appreciate it. So happy for Crystal and the success that she's had in this program, and really also special that she's going to be able to take this and help so many other people, chief among them her children, who she's already starting to see manifestations of autoimmune disease creep up in them and digestive problems creep up in them. Well, she is now going to be the example and the savior for her children because she knows how to stop this, and she's got Dr. Maggie who can also help out. If this sounds like something that would benefit you or somebody in your life, and you'd like to get more information about how the Transform program and Dr. Maggie could help you out, reach out to a member of the team. There will be a link above or below this video, and they will get you resources to help you out to get started. On behalf of Dr. Maggie and the whole Transform team, I'm Anne Imanuel. Thanks for watching.